Hi there, my name is Dr. Bob Marcus, and today I'd like to talk about why DDS GP? Why get this app? Why bother? And I guarantee that my answer is different than what you're thinking it will be. Take a moment and answer the question. All right, I think your answer might have been, well, so I can better show patients their diagnosis, so they can understand better what's wrong, so they can understand the steps to doing the treatment. And that is exactly what DDS GP shows. But that's not why. That's what. The why is much more complicated. I'm going to take you back to when your 40-year-old patient who's sitting there right now and has a cracked tooth and needs a crown. I'm going to take you back to when that patient was about 21 years old. Back then is when he or she decided not to go to dental school and not to pursue a career in dentistry, at least almost all your patients. This person decided instead to go to law school, become a plumber, or do whatever this patient does. And that was the moment they decided they did not want advanced dental education. Yet we as dentists feel this importance in educating people about the thickness of enamel and about why this spot looks more gray on their x-ray. Here's the thing. What patients want is you. It's especially true in this day and age where there's a lot of people working from home. After COVID, a lot of people retreated into their homes and they don't come out very often. I recently read that 75% of restaurant food is delivered outside the restaurant. Who would have thought? Eventually, they won't even have tables and chairs. How do we capture this into what we do? Well, we have to be honest with ourselves. What do patients need because they crawled out from under their rock and they came to your office? Do they need to learn how to be a dentist or a hygienist? Or do they need to learn that you and your team are there for them? You care about them. You are to be trusted with their care. Regardless of what goes on behind the scenes at the dental office, what goes on in the front has to be that feeling. If you stand above a patient and point at a screen and lecture to the patient about why this and why that and what this means and why this area right here that appears a little bit more gray is decayed and that area isn't, they don't care. They'll nod their head. They want to be polite. What they want to know is you care. This is the why of DDS-GP. It's on the iPad because it's purposely held in our hand. I always encourage doctors, don't prop the iPad up on a table, sit right next to the patient and hold it. I've had patients literally hold on to the other side of an iPad. Weird, but now they're really engaged. At that moment, take the moment to foster trust, understanding. Instead of saying to the patient, here's decay, now it's worse, instead say, hey, Mary, look, there's a problem going on right here. Can I have your permission to talk about it with you a little? I don't like to be negative, but this is an issue. You see the difference? And then I might say, continuing along, Mary, as you can see in this picture, you see this little black area right here? That's how decay looks when it starts to invade a tooth. And once it gets to the inside of the tooth, it can start to hurt and be much, much more difficult to repair. When it gets really far into the tooth, we end up with a lot of problems. We end up with problems that are not solvable with easy dentistry. The good news is yours hasn't progressed to that point. Let's get together one day, maybe next week, spend an hour together, and I'll get this solved for you, right back the way it was before this happened. If you look here, what I'll do is I'll remove the problem area. And I'll go ahead and put a filling in that exactly matches the colors of the teeth. Here's the beauty of that. As soon as you're done here, you can go home and use that tooth normally. You don't have to baby it. I care enough about you to use the best materials and techniques, and I will make this right for you. Do you see how that type of narrative shows patients you care as opposed to showing patients you're smart? Because you have a DDS or a DMD on your door, they assume you know the procedures. They assume you know how to read x-rays. And if you think that showing them that you're smart is what they need, you're wrong. So, what's the why of DDS GP? It's exactly what you just thought of. The why is the relationship. It's bringing people together in a world where many of our jobs, especially these work-at-home positions, have driven us apart. Use DDS GP right, and your case acceptance will go through the roof. Mine did, and it'll take your office to the next level.